Good morning, everyone. Hope you are well. I'll wait a few minutes for people to join. Morning, everyone. I can see those numbers are still climbing up, but I might kick off and it will not be difficult for people to catch up as they join. But welcome to the August Family Preservation Sector Forum. Thank you very much for registering and joining with us today. Got a pretty action-packed agenda, so hopefully it covers off a few things that you are interested in and gives a sense of our priorities for the next month or so. I'm Brianna Yorgate. I am the Director of Family Preservation and Child Protection. I'm joining you from Barramadigal land of the Darug people, and I pay my respects to these traditional custodians of this land, extend that respect to our Aboriginal colleagues who are on this call, in the teams that work alongside us, and the families and communities that we serve every day. This piece of work, this program is so fundamentally important to supporting self-determination and better outcomes for Aboriginal children and families, and we always keep that at the heart of our work. So, as I said, I'm Brianna. This is the second forum following the commencement of our new contracts. And as I mentioned, and we talked about last forum, really keen to make these a kind of lively and interactive engagement for people. You have the opportunity to ask questions throughout. Pretty relaxed about that. You can pop things in the chat if you need to. If you're not speaking, obviously just pop yourself on mute. Sometimes that background noise can get a bit distracting. Just raise your hand if you do want to ask something. And of course, note that we do record these, so colleagues who can't attend can watch these at a later point, and we pop that up on the microsite and other things. We had a little bit of a kerfuffle last sector forum where some people weren't aware of the registration process for that, so we've sent out some comms about that. So thank you to the 3 people that are joining us right now. You've figured that out, which is really great news, so thank you. Today, we want to cover a few things off. So want to check in on where we're at with referrals and capacity management system, do a little reminder and plug for our implementation survey, just check you in and share kind of how we have put our resources on our microsite, which has had a revamp, talk about outcomes tools training, and then have a really good conversation about our future thinking and work that we have on client experience measures, and also have a quick verbal briefing on prioritisation, allocation and triage, which is a big change that we are implementing at DCJ. We had put a call out for any other items of interest or topics that people might be interested in. We didn't get any major kind of comments or suggestions back, but do keep that in the back of your mind. We're really happy to be responsive to what people need or would like to talk about or would find valuable. So obviously reach out to us at any point if you have thoughts for the next or any future sector forums. So I thought it would be helpful before we go into those substantive items to just obviously position us where we are in our implementation journey. So as I said, we are now in month 2 of the new system, which is really, really exciting. And it is we're certainly in that world of normalising a lot of our processes and getting things up and running, and our providers building that capacity and working with families, which is really great. So this is the graphic that we've taken from our implementation plan that just helps kind of focus where we are on things. The bottom chevron is probably the most helpful thing to kind of as a checkpoint of where we ought to be at. So establishing our family preservation implementation team, that recruitment is underway. Launching InfoShare we have done, launching partner community we have obviously done. We are in the process of thinking through and then reaching out to our ACO providers of AFP around the governance of that framework. We are doing our thinking around establishing our communities of practice and want to talk to you about that very soon. We are also doing our thinking around the new call service and our cultural frameworks. And then today, of course, we are talking about our client experience survey. So if you're kind of ever a bit lost on where we ought to be as a system and what we're working on as a program team, this implementation plan is a really good anchoring point for that. On a more practical note, if we move on to the next slide, this might help distill where service providers should feel like they are up to and what they should be up to, what other things they could be engaging with right now as well. So as mentioned, partner community and InfoShare all set up and being used, which is great. Collecting info through for the MDS, managing referrals and updating service delivery information through partner community, and engaging with the capacity management process. So these things all seem to be being established and working well. Obviously some teething challenges with some of these, but nothing too concerning. Some other things that service providers may be engaging with and welcoming. Sorry, I've just got a slightly distracting email in. Encouraged to do around using the GEM and the PEAM and attending the training sessions next week, and familiarising and sharing yourself with the Family Preservation Key Systems Changes fact sheet. So we distributed that last week, and you are encouraged to share that with your kind of broader partners to explain the changes that DCJ has implemented to the program, and obviously the implementation survey. So that's a bit of scene setting. We're hoping that if we are able to kind of be really clear each month about where we are at as a kind of program or system and where you need to be at as a service provider, that will help keep you grounded and on track and not too confused about where we're up to. So we wanted to obviously talk about the new referrals and capacity management system and approach, which we have stood up. This has been a really important change that we have implemented in the last fortnight. So we just wanted to take an opportunity to just make sure that everyone's on the same page about that and reflect on some of the things that we've identified through the implementation of that process. So if we go on to the next slide, this is just a bit of background as to the, what we covered off in the briefing about capacity management, why we are doing it, how long we will be doing that for. And so I think, as we discussed in that briefing, if you weren't otherwise at it, understanding capacity and utilising that capacity is fundamental to making sure that family preservation is being delivered to the families who need it most, and is being used effectively and not under-servicing or under-supporting families. Understanding the lay of the land across the multitude of providers who are delivering family preservation programs, what they're contracted to deliver, what they have online, what places are being occupied. All of these things are really important for us to understand in a consistent format, so we can also help drive utilisation of those places. We know that the approach that we are taking now is an interim approach, and that we know that there are dealing in spreadsheets and SharePoints, not the most autonomous or automatic kind of processes where we're linking data. We are really keen to test this out, see what works, what doesn't work in terms of business processes, and then move towards a more enduring technical solution going forward. But this is our process for the remainder of this year, and as I said, we'll work with you to understand how that is going forward. The next slide, thanks. Just kind of is a check-in on where we're at with that process. So last fortnight, our providers entered in their data into their registers, and that is a fortnightly process that we will be doing going forward, and that's and doing so consistently. So that's really great. We've also established in child protection and permanency, our local family preservation referral groups, where CSCs or the MCSs need to coordinate, where we have multiple referral pathways into providers. So those processes are being established in the localities where that is required. Sometimes they are not needed, where there is a really neat fit from one CSC only one CSC referring into a provider, lucky them. Other times there is a coordination approach required across DCJ. So we're just working through that process and settling that. The next slide, as I said, so we kick this off on the 31st, and thank you so much for your inputs into that. We were very I don't want to say pleasantly surprised, but we were really pleased with the level of engagement from service providers and the kind of accuracy of information that had been provided in those registers. There were certainly some teething issues, some instances where people changed some of the formatting in the tables and slightly messed up some of the read across and connectivity with dashboards and things like that. But I think we've ironed some of those issues out. But on the whole, really, really great engagement from service providers on that. Those returns allowed us to produce dashboards for CPP to understand what capacity and utilisation was looking like across New South Wales. And so that's really helped us this fortnight to increase our referrals into places where there has been capacity. So hopefully you are starting to see the benefits of this approach, where we have child protection and permanency colleagues really progressing those referrals through. And so the next round of returning those registers, thank you, is on Friday. But I do want to acknowledge, if we go into the next slide, thanks, Tat, that, as with the implementation of any kind of change or process, we've had some niggles, and generally the themes from that have been around system access and user permissions, which I think we have tried to be really clear about and manage. If you're having problems with that, obviously please email us. Lack of clarity in some respects around referral and reporting processes. So we're trying to establish and promote the range of kind of guidance and materials about this. If you are still experiencing or witnessing these, do reach out to us and we will jump on it. We know that there is a few different angles to this where you might be seeing it. We're really keen as a program team to be able to lean in and give direction, whether that's to service providers, commissioning and planning, or operational colleagues, to make this work. So if you are in doubt on how to, what the process ought to be, or people aren't following processes, just reach out to us and we'll try and go and troubleshoot and problem solve. No one is in trouble, I should say, as well. So please don't have kind of fear of consequence of speaking up. We all want this to work. So it's just really important we know what's going on the ground. We obviously know kind of from some of these niggles that some additional implementation support and guidance is needed, and we're working that up. we think a lot of that is about us being able to engage with people as we go, and we have different fortnightly processes around this, and over time really building that confidence and capability in the processes and systems, and providing that engagement and support, and not relying exclusively on written materials. Just some reflections on the capacity reporting and register management, some challenges around point in time information, and the rules about when we would have, when the kind of cutoff date is for producing reporting, and just some issues around kind of clarification on roles and responsibilities across different parts in DCJ as well. So that's some of the themes that we've picked up over the last fortnight. We've got our systems in place to try and pick up and resolve those and smooth them through. It's, as we say, it's an inevitable part of change that these things come up, but the really reassuring point is that people are engaged and telling us where support is needed, and that we can action that and get on it, which is really great. So thank you for that. I think that, sorry, is that someone had a question or comment?
That's all right. I tried to call all of you at one stage. All good. I'll just loop in.
I think that's someone on a different phone call. I'm not sure if we can mute that poor person. I'm glad they weren't saying anything controversial. So next cycle, as I said, starts on Friday. So service providers, please make sure you have accurate and fulsome reports submitted on Friday night. Commissioning and planning and my team will be then picking those up on Monday morning, using that point in time information to produce our reports to share with child protection and permanency for the next fortnight of referrals. Okay, so I think that's us on capacity management. I might pause actually, because again, we are not in the Brianna Lecture Theatre. If there were any questions or comments that people wanted to raise, sorry, I have I'm not at home today. I have colleagues in the room and they're laughing at me. Thanks, Simone. If there's any questions or comments from people about that, or areas of focus that we could pick up that we've not quite clocked yet. Okay, fantastic. This one's just a reminder about the implementation survey. So a short any indication on when community referrals will be open? Thanks, Daniela. As we've said, community referrals are ceased for the duration of the transition process, and DCJ will be in touch when they recommence. We've got obviously a range of processes and systems we really want to make sure are stabilised and functional before we do that. So sit tight and we'll let you know. But certainly not until we are through the third phase of transition. On the implementation survey, so that closes in 8 days. So on Friday next week is the last day that you can submit a response to the implementation survey. This is a really important data point for us to understand where people and organisations are in their implementation needs. It will be used as a really valuable source to prioritise and target our implementation support going forward for this phase of work, and particularly through to Christmas time. So if you haven't already, I really strongly encourage you to either individually or bring your teams together to engage with that survey and do so by Friday next week. Thank you. Learning capability and resources. This is also a really quick one. We just wanted to share, if you haven't otherwise spotted already, we've done a really big revamp to our website, and that is to make sure it's really clean and functional for you to identify your resources. So this is a screen grab of what it looks like now. We have a range of new tiles. So we have put our historical information of the whole journey of recommissioning in one tile. So it's still there for you to see and navigate, particularly for new starters to your organisations who may not have been on this journey, but it is kind of contained in one space. Then we have tiles around our models and frameworks, which is really important. We have a tile around how to engage with us. Oh, thank you. We'll do it that way. That's perfect. Thanks, Tat. So this is the tile around our models and frameworks. And so you go into that and it will have one for families together, Aboriginal Family Preservation, MST, FFT and NABU. And then within those pages, you have access to your key resources for those models, so the ops manuals and things like that. So that is a way for you as a service provider to really readily and easily navigate the key documentation for the model or framework that you're delivering. And we just wanted to make that really well organised and obvious and easy for people and easy for others outside of the family preservation program also to be able to navigate and understand. The next tile is around other resources. So we have here, as you can see, kind of screen grab that has our info share and partner community information. And a whole range of links as well about the key information around implementation, a blurb around our phasing. And this is where over time we'll be building out more resources and information about how we go. So please familiarise yourself with that. You'll probably end up needing to check in on that over coming months. Thanks, Tat. Oh, those were the two key. Sorry, I thought we were going to go through every page. That was my bad. Those were the two main pages that we really wanted to flag with you. If you are having challenges navigating or finding any information on the website, let us know. We're really trying to be very transparent and easily accessible about the program. We do get a lot of queries through our mailbox about different things which are publicly available. So if you have questions, please do look on the website as a first port of call, or you could use your choice AI agent to help you find certain information. If that is still not fulsome, obviously, please reach out to us. But there's certainly a lot more there in the public domain than there ever has been. So I encourage you to engage with that. On outcomes, tools and training. So thank you all very much. We have a really exciting week ahead next week. We are delivering 2 important training modules on the GEM and the PEAM. The times are there on the slide. We sent out invitations to this on the 30th of July with links for registration. Pardon me, I understand we have really good numbers for this. If you are expecting to attend this and you haven't otherwise registered or you haven't otherwise heard, please get in touch. These are the times. So you might want to organise your diary so you can come to those. The sessions themselves, I will be kind of kicking off and setting the scene for the use of these tools in our program. And then we'll have the developers of these tools to be able to talk about them in technical detail, which is really, really exciting opportunity. We are going to record those sessions so they are available to staff who can't attend and then other staff who may join your teams later on down the line who need to engage and kind of get up to speed on the use of these tools. So we're really, really excited about being able to roll out this training. Do have a think, as I mentioned last month, about whether as a team or a group you also want to book in or arrange some time to debrief together or reflect on how as an agency or a team you want to work together to make sure that these are implemented in the way that they need to be, and just to reflect on the training. We'll be really keen to hear your feedback as well after the training about how you found it and whether it met your needs or not, and if there's anything else that you would like support with. So that's our outcomes tools training. We'll obviously be working with you and using the implementation survey as well to map out a schedule of other training and learning opportunities over the coming months. We're really keen to get the most critical and essential ones in first, and then build out that offer more fully for the next 12 months. If we move on to the next slide, this is a fuller item and something that we haven't spoken about as a group. So if you've kind of had other conversations going on in the background and not paying full attention, this might be an item to tune into. We want to talk to you about client experience. And pardon me. And you will have seen that as a program, we're really, really committed to understanding the experience of our clients who go through this program. what that experience means, and over time, what the relationship between that experience is to the outcomes that families are able to achieve through the program. So we flagged, in our discussion paper in 2024, our ambition to develop a client experience measure. This is something we've always had on our radar. And in our implementation plan that we published in June, we talked about developing and testing a measure in this establishment phase of the program, so between now and September next year. We see client experience, or a measure around client experience, as an important part of a suite of measures that help us understand how the program is being delivered and whether it's achieving what it is designed to do, and is a really valuable insight into the actual quality of service delivery. We have few systematic ways to really understand quality. We often are relying on things around volume and engagement, kind of duration and things like that. But we have had historically weak systematic ways of understanding quality and client experience as part of that. So if we move on to the next slide, please, thank you. I think and from our discussion paper and other conversations and consultation, we know that this sector is really engaged with making sure that families are engaged in their service delivery and have agency and voice over what the program can look like and help them achieve. And that's a really positive basis for us to go into this. So our views are that in measuring client experience, that's a really important signal to both practitioners and families that this matters, and provides us a source of information to help give clients a voice in a system which is obviously inherently bureaucratic, to help understand how clients are using services, to help us identify where there are pain points in our service delivery or our program design, make sure that we are always anchored in our clients, in our children, in our families and what they need, and that we're able to drive change. So if we go on to the next slide, these are quite fulsome, so you will have time to read these, and we will be talking more fully about these in our consultations. But we really see kind of a stratification of aims and purposes for this. So as I say, the signalling to clients is really important, and the signalling to practitioners is really important in and of itself, that client feedback matters. And I should say, and I should have on previous slides, that we see this as a part of a broader understanding of client experience, not the sole means of evidence about that. This is not a substitution for focus groups or evaluation or other forms of kind of sense making or engagement with families about their experience, but it is one way of us systematically understanding this. And it's also not a substitute for formal complaints processes. So we are really keen to make sure that, we can delineate understanding client experience from formal complaints processes within organisations or DCJ. Thirdly, on this chart, it's an important signal. Moving up a level, it is, if we are able to collect this systematically, it can help service providers continuously improve their service delivery for families, and either the specific families or families more generally that they are servicing, and then also at the kind of highest levels helps us understand this over time, so we can look at whether we need to make actual different design decisions or changes in the program, and how we've kind of talked about core components or service activities or other elements that are contained in our specifications. So that's a kind of stratification of how we intend it to be used. I think we might have one more slide about this. So this is just the process about how we want to take this work stream forward. So this was just a bit of a taster of how we're thinking about it. Over the coming months, we want to consult consult with you. We're also consulting with a range of stakeholders with lived experience to understand those perspectives as well. We spoke to the peaks about this last week in high-level terms as well, and really understanding what providers are doing now in terms of collecting a client experience, if they're doing that, and if not, that's also fine. So really understanding the lay of the land, understanding what some of the perspectives and challenges around that may be, and then develop effectively a draft survey that we would be using with clients throughout their service delivery to test and refine that. And then with a kind of user testing environment, and then piloting it from next year. And that's a process that we would like to go through. We're very mindful of Indigenous data sovereignty around this as well, and we'll be having a distinct approach for engaging ACCOs about this. But we really just wanted to make sure that was on your radar. If we move on to the next slide, we'll be reaching out to you about this. So we anticipate sending you in September, which is terrifyingly next month, a survey about what measures your organisation may currently be using with clients, and then to allow us to set up and arrange a series of workshops with you around what this could look like going forward. So this is really exciting, really, really exciting work, and hopefully you're up for it, and there's really good lessons we can learn from approaches you've made in the past. Pardon me. I might just pause there because that's kind of new information and perspectives, and I just wanted to see whether anyone had any questions or thoughts on that. I've actually just spotted, sorry, Jessica, is there a link to where to register for GM and PEM? The email doesn't work for others and can't seem to find on the microsite. Thanks, Tat, for popping that in. I was hoping you would do that. So there's the links. But anything on outcomes measures, client experience that people wanted to ask about at this stage, or you're most welcome to think on that and come back to us. If you want us to talk a little bit more about this at Next Sector Forum or provide additional information. What a talkative bunch. Okay, no problems, all good. I'm on a real roll. So we can also, there'll be time at the end of the meeting.
Brianna.
Yes.
Kimberly here. I'm just wondering, hey, were you thinking about doing different client measures for like for AFP and for family pres, or and if so, would the governance group be involved in the development of that? How are you imagining it?
So we're really open. We are probably approaching it with a view that we'd like to understand I'll have a consistent approach to client measures across all clients in the program, rather than having different measures administered to different clients depending on whether they are Aboriginal or not. But that's something we're really happy to talk through and work through with our ACCO leaders and state ARG and other Aboriginal stakeholders or people with lived experience to understand whether we do need to take a differential response to that. I think our kind of starting position is to have the same, so we can understand that and have that utilisation, but we're not closed to thinking about whether it is necessary and valuable to have differential approaches.
Yeah, my only comment for that would be that they have two different approaches as well, like similarities but also differences. Yeah,
absolutely, and that's the stuff that we want to unpick when we talk to people, to really understand what that means, because obviously importantly for Aboriginal clients, the understanding of cultural safety and responsivity is critical to service delivery in a way where those dynamics are not so relevant to non-Aboriginal families. So just working through what that can look like.
Yeah, the advocacy and healing components.
Exactly. Yeah. Okay. Anything else? I'm really excited about this work. It is, I think I reflected on our conversation with the Peaks last week about it, and it's somewhat nice to have something new and positive to engage with in a way that's not just about operationalizing, the core business as usual, or not business as usual, but the core kind of business transactional things like referrals and capacity. So yeah, it's really exciting. The last thing that we wanted to touch on today was just give you a verbal briefing on changes that we're making at triage. Some of you may know that the other part of my job, apart from family preservation, is working on child protection policy. That part of my team has been very busy for a number of years looking at what DCJ has been doing at triage and how we can do that differently. And July was a very big month for me. We had family preservation changes, and we introduced a new approach to prioritisation assessment. We just wanted to take a moment here to talk that through and offer you an opportunity to ask any questions. So if we move on to the next slide, thanks, chat. You will have, we shared with you a fact sheet about this. I'll forgive you if you didn't read over it. There's lots of materials that kick around. But on the 29th of July, we launched a new prioritisation assessment policy, and procedure at DCJ. And this is effectively the policy and procedural governance around decisions taken for much of the state and in a CSC around allocation of matters to caseworkers, but in Metro, the centralised triage team that covers all of Metro. The purpose of this policy is to improve safety, wellbeing and welfare of children and young people, and to make sure that DCJ is prioritising the most substantial child protection responses for the children who are most at risk of harm. So we have classically called this kind of part of the system and this function triage, and it being the bit that happens after helpline but before face-to-face assessment. A really kind of important language change for us is to be calling this prioritisation assessment, to make sure we're really clear on the decision that is being taken and the assessment approach for making that decision. Crucially, we have identified over the years, as I'm sure you have as well, that we can do better in this space to support a broader range of children. So if we move on to the next slide, this is just a plotted history of how the review has taken place. So in 2022, we started the policy review of this part of our system. It was a really fulsome kind of analysis of what is a really complicated operational set of decisions for DCJ. From that, we really heard three main things that needed to change. So first of all, we needed a more structured and streamlined process for our triage caseworkers to follow. We needed more effective quality assurance over the decisions that are being taken, and we need to provide our practitioners with more specialised and purposeful resources. So these are really important things that we've needed to heed to make the system more effective, and that our policy now, we're in the space of having a new policy which is really anchored in prioritise, see and support. So better understand at prioritisation the needs of children and identify who of those children are most at risk, see those that are most at risk and get a fast response and get that as a decision as quickly as possible. And then for those who aren't seen, ensure that they receive alternate and purposeful early support as well, and move from a kind of, as the Ombudsman referred to, a culture of closure. If we move on to the next slide, this really is just kind of teasing that out a little bit more. So we really want this part of our system to be more oriented towards supporting children. It is a crucial nexus point for us, and we want to be able to be focused on the outcomes for children rather than necessarily business processes. We also want to reduce inefficiency and duplication. There are definitely inefficiencies across DCJ and within the function that could be ironed out, which then provides us better capacity to support support the children who are reported to us, and to increase our consistency and accountability across the state and make sure that we are really clear about how these decisions are to be approached and how we are going to be accountable for those decisions. We have taken a principles-based approach to this policy and this work, and really anchoring it as ought to be on the best interests of the child and as the paramount consideration of all the decisions and processes followed at triage. And then with a range of other principles as well, including most at risk. And I've said that a couple of times now, but really making sure our efforts are targeted to the children most at risk of harm, that they are that we were really purposeful about the work that we are doing, and we have a clear line of sight as to why and the value that we add or don't add at prioritisation, that we take a proportionate approach to that work, that we take the least intrusive or provide the least intrusive response to families, and that we're really transparent about what we're doing. Underpinning all of this is obviously a really important opportunity to improve outcomes for Aboriginal children and families, and that needs to be centred in the decisions that we make at triage as well. The next slide is just how our changes are trying to drive benefits for different people. So obviously for children is at the heart of this, more support and supporting those most at risk and trying to get that support in earlier. For caseworkers, really supporting them through better records, better structures, better supporting materials to make decisions, and for our systems, obviously being able to make sure our resources are prioritised to the children that need it most, but also that we're meeting a range of legal obligations in how we do that work, and that we do that work efficiently and not duplicatively. For those who love to understand the nitty gritty of what this means and what the changes look like, and some of you may be more or less familiar with what DCJ does at triage anyway, but this diagram is really the kind of stylised decision-making process that we go through. So on DCJ will receive a report that will be screened at helpline, and Part A commences when we receive that report in. The first decision that needs to be considered is whether that report requires an immediate allocation and or is in the category of an exception to a full prioritisation assessment. And so this will be emergency responses would fall in this category. Others would be where there is already an allocated DCJ caseworker that the report can just be progressed to and considered in the round of other material that caseworker is engaging with. For all other matters, the first part of the Part A is to make an initial prioritisation review. And in this, there is for every report, DCJ will be looking at the likelihood of potential harm and the severity of that potential harm for a child, so that we can understand which of those children that we have reports for most at risk and require face-to-face assessment. From that initial review, a report, or a child I should say, is put on either an allocation pathway or an early support pathway. So for those most at risk, they are placed on the allocation pathway, where they will be allocated to a DCJ caseworker to be seen. It's really important that as part of this process, we're really clear around that pathway being tailored to the capacity in various different teams. So, you know, a particular CSC or a prenatal team or whatever it may be, and that all of those children on that pathway can and are seen in a timely way. And then for those children who are less at risk, to go on an early support pathway. And through the early support pathway, this is where we're creating more structure in our process to understand the risk to the child, make other investigations around that, or phone calls, or engaging families or other services to understand that risk and arrange any appropriate supports that are possible. So that may include sharing information under 16A, making referrals or other things like that. And then it's important to note that the only pathway to closure at prioritisation is via that early support pathway, where those assessments and considerations need to have occurred prior to closure. So basically what we're seeing in this diagram is a flow from a report coming in, either being allocated for face-to-face assessment where it is progressed under other policies and approaches, or the report or the child in the report being supported through the early support pathway prior to closure. So that there is just some key things for you to for your touch point with the system in family preservation around this is, as I've mentioned before, the language change. So you might hear DCJ colleagues talking about prioritisation and allocation decisions with slightly different language to what they previously did. They'll talk about an allocation pathway and an early support pathway. Your interface with triage teams will largely be on this early support pathway, where you might receive phone calls from triage teams around understanding the risk to a child and or the sharing of information or other supports and referrals. So that was where you're likely to hear. You might also hear DCJ talking about prioritisation levels for a family or a report. So we're just kind of to have those on your radar. I know a lot of you have, we may use the term WAM or weekly allocation meetings also as a shorthand reference to triage decisions. So those are not always implemented, but meetings which have been used to do the prioritisation decision making, these are no longer required under the policy. Different teams may still have other kind of processes for engaging with service providers and support systems to make decisions. And so they may continue to use WAMs, but it's not mandatory under the new policy. I think that was it. If you wouldn't mind just jumping to the next slide, I think. Yeah, so what's not changed, probably really important to know, Care Act is still the Care Act. We've not changed the Care Act. And as I said, you may be contacted by your triage teams in the conduct of the early support pathway. We've not changed interagency meetings or other kind of approaches to collaboration with partners. JRU and JCPRP continues to operate as does. They're kind of out of scope of the triage policy. They have their own MOU and processes to follow. Yeah, just an important note on referral prioritisation for family preservation in particular. Our program obviously allows for referrals from triage, but note that part of our program design is that we prioritise matters where we've determined in need of care and protection, so we can be targeting family preservation places to children most at risk. But this is referrals at triage are still allowable under our policy where they're obviously purposeful for the family. We've got a couple of questions here which I might take. So we've got Jess Evans, for early support pathway referrals to FT, will the family's consent be sought to referral despite not having a face-to-face assessment? So we've got this kind of in our family preservation referral information as well. We note that best practice is to engage the family and kind of talk to them about prior to making a family preservation referral. That's not always possible or preferable. So that's not a hard requirement for us. And so there is kind of a discretion for our triage workers on whether to engage families or not before making that referral from triage. So if you receive a referral and it's not clear whether the family's been contacted or not, encourage you to reach out back to DCJ to understand that context before you contact family as well. Richard, could you please provide further detail on the strategies being implemented to increase referrals during implementation phase in addition to the fortnightly WAM meetings? The current referral process or pathway does not appear to be keeping pace with the number of families completing FFT through existing services or with the referral volume required to meet funded targets to benefit more children and families at risk. So thanks, Richard. I think this is a broader question around our capacity management and utilisation approaches for family preservation. So we're really clear that we are in a state of transition, in fact, a stage or phase of transition in our implementation paper. We are really ramping up this system to operate in line with its design. And our changes that we are implementing on understanding capacity and then utilising that capacity, and DCJ prioritising its families for referral is a really critical part of that. This fortnight, we have seen, pardon me, and we shall see in your kind of returns on Friday, a really marked uptick in referrals being made to service providers across the breadth of programs. And so that's a really important approach. I think what I would probably say is we are not expecting this system to be at full, or our family preservations to be fully utilised right now. We are in a stage of ramp up in this kind of third phase of the transition. And when we're in steady state, we would expect to see those high utilisation rates. So this is a considered and purposeful approach to ramping up those referrals, and certainly the approaches that we're taking using the dashboards from the capacity management approach, and then working with child protection and permanency colleagues, are about making sure we can utilise those places, but for the families who need it most. So making sure that we're not losing sight of the purpose of the design and the changes in trying to just fill places. So hopefully we'll be seeing us reach steady state quickly, but we know that is a journey that we're on at the moment. Are there any other changes about either, I guess, or any other questions I should say about prioritisation, capacity management, referrals, or anything else that I might be able to pick up? We don't have any other substantive things to talk about. Gemma?
Yeah, I just had a question around the cold referrals versus the warm referrals coming from triage. So will there be some data tracking undertaken of those referrals just to check whether, there is significant impacts when that cold approach is being taken?
It's a really good question. I'd have to look at our what we are systematically recording on Child's Story, either in the triage record or on the universal referral form for family preservation, and come back to you on that. I can't remember off the top of my head what we're collecting, but that's a really, really good question about efficacy. And I think it's linked also to that engagement in the first 3 months of service. There's a whole piece, I think, that we are considering in the context of our evaluation strategy about how do you engage effectively early with families and make sure that you can sustain service delivery and not have drop in and drop out. So
yeah,
that's a really good question.
Absolutely. And then the other part of that is for the cold referrals. So I don't know the current policy, but I know that a report had to be considered previously within either 28 or 30 days. So whether those cold referrals are going to be made sooner into that time period, or whether we might actually be receiving referrals where the information is quite old, which then may also impact on that uptake from families.
Do you mean from receipt of the DCJ's receipt of the report?
Yeah, I'm just mindful that if they're going to potentially be going to WAM to be considered as a cold referral to an agency, that may lead to some delays that could then impact on a family's willingness. If they're out of that immediate crisis, that might then impact on their willingness to engage in a cold referral.
Yeah, I get you. So in our policies, we've been really in the triage prioritisation assessment policies. Look at me already using old language. We've been really purposeful about time limits on things, because if you read the Ombudsman No Capacity to Allocate report, you will have seen that the timeframes initially introduced to, quite rightly manage timeliness in response were then used to justify closure. So we've been really careful about how we've calibrated our timeframes. The early support pathway does not have hard timeframes of when you have to have done X, Y, Z things on, because the work in the early support pathway needs to be proportionate to the risk to the child and what will be beneficial to them. So if we go back to our principles, making sure the activities that we undertake to support the child, thanks Tat, are purposeful. So if and this is a consideration for our triage workers, if time has elapsed so far that a family preservation or any other referral for that matter is not going to be purposeful for the benefit of the child, then don't do it. That's a tick a box exercise. That's not good for anybody. So there's not hard rules. What I would say is we're trying to take a principled and pragmatic approach to this, but central to the whole triage process is making smarter, quicker decisions about when we are allocating and what we're doing for those who aren't. So I think, it'll be really important for us to monitor and see how this goes to make sure we're picking up any unintended consequences. And I'm always really welcome to hear from this part of the sector about how that's looking and going.
Yeah, great. Thank you, Brianna.
Great questions, Gemma. Nice. We'll have to talk to you when we have our evaluation strategy for our various different things. So we are 5 minutes out. I don't think we had any other questions in the chat either. So all we wanted to do in other business was just to signpost the various different places you can go for help on anything. So obviously our partner community, child story partner community, contact information, InfoShare, contact information if you're having technical challenges. There's resources in partner community on the knowledge articles that you can look at, and additional resources in, InfoShare as well. So if you're having problems, obviously try the resources first and then the email second. You'll get a quicker response going direct to them rather than via our mailbox, but obviously you're always welcome to contact our mailbox. The next slide is just how to get in touch with us. So Family Preservation at DCJ, always welcome to reach out to us. Kim was brave enough to speak up earlier, so thanks, Kim. Kim and Sherry Ann for ABSEC, Daniel for FAMS, Kate for AQUA, and Angus for the ASU. We meet with them monthly and also have conversations in between those monthly meetings as well. So a really good line of connection through to our colleagues there. If you feel that it is safer or more appropriate for you to contact your peaks about issues rather than the Family Preservation team directly. I think, oh yes, that's right. So, just a plug, of course, we talked about this at the top of the meeting. In these forums, you'll need to register for separately. There are kind of technical reasons for that, which are really important. So please make sure you and your colleagues are aware of that. We try and promote that. Those registration links are on the microsite and contained in the newsletter. Please encourage anyone in your networks to say subscribe to our mailing list. Hopefully the resources that are coming through or the updates are helpful. And if they're not, do tell us. Our newsletter, we're really trying to make sure that you've got the key information that you might need. We will in turn want to jazz these things up with some good stories and other interesting insights from yourselves and clients and things like that over time. But for now, we're just getting through this kind of third stage of our transition. And then the last plea, as I said earlier, is a future item. So our next forum is on the 10th of September. If you have other topics or things that you want us to cover, please reach out. We're really happy to accommodate that. We're happy to pull in guest speakers as well, so you don't have to listen to me drone on. So please get in touch, and we'll use the implementation survey as well to also drive the kind of topics that we can talk about at this forum. But that is us. So thank you all very much for joining. Thank you for your excellent hard work. Thank you for engaging in the capacity management processes. Hopefully this fortnight you've seen an uptick in referrals and that we're on a really nice trajectory through to steady state coming out of this third transition phase. So wonderful. Thank you so much.